That headache you woke up with this morning? The neck stiffness you wrote off as sleeping wrong? The ringing in your ear that comes and goes? These are not stress symptoms. They are not getting older. For millions of people, these are the only warning signs their body ever sends before a heart attack or stroke, and they miss every single one of them. High blood pressure kills 1 in 5 adults over 50, not because the disease is untreatable, because it has almost no obvious symptoms until the damage is already done. But almost no symptoms is not 0 symptoms. There are 5 specific signs that your blood pressure is dangerously elevated right now. Each one is subtle enough to dismiss. Each one is specific enough to recognize if you know what to look for. Number 3 is the one that sends people to the emergency room, not because they were feeling terrible, because someone finally told them what that symptom actually meant. First, a critical clarification. High blood pressure is genuinely called the silent killer because in most people, it produces no symptoms at all, even at dangerously elevated levels. If you measure 150/95 and feel perfectly fine, that is medically normal. You will not feel a blood pressure of 150 the same way you feel a fever of 103. The body simply does not work that way. So when I say there are 5 signs of dangerous blood pressure, I am not talking about the symptoms of hypertension itself. I am talking about the symptoms of what hypertension is doing to your organs right now. Your heart is working harder, your blood vessels are under pressure, your kidneys are filtering blood at elevated force, and your brain, the organ most vulnerable to vascular damage, is receiving blood at a pressure that causes microscopic changes with every single heartbeat. These 5 signs are your organs talking. Most people are just not listening in the right language. Sign number 1. You wake up with a headache. Not a migraine, not a pounding, debilitating headache that sends you to the medicine cabinet. A dull, persistent ache, often located at the back of the head, just above the neck. Sometimes worse when you first stand up. Sometimes there before you've had your first coffee. You blame the pillow, or dehydration, or the fact that you did not sleep well. These are the things most people tell their doctor when they mention the headaches at all, which most people don't. Here's what is actually happening. During sleep, blood pressure should drop significantly, what cardiologists call nocturnal dipping. In people with uncontrolled hypertension, that dip does not happen. Blood pressure stays elevated all night. By 4 or 5 in the morning, as the body begins waking up, blood pressure surges further. In someone with untreated hypertension, that surge can push systolic pressure above 160, sometimes above 180. The increased intracranial pressure from this blood flow creates that dull occipital headache, the one at the back of your head, that you feel before you have even gotten out of bed. If you are waking up with headaches at the back of your head, even mild ones, even occasional ones, and you have not had your blood pressure checked in the last 6 months, that is the most important thing you will do this week. Not because every morning headache means hypertension, but because for a significant percentage of people with undiagnosed high blood pressure, that headache is the only signal their body has sent in years. Sign number 2, and this is the one that surprises people the most. You wake up at night to use the bathroom. Once, maybe twice. You've been doing it for years. You assumed it was your age, maybe an enlarged prostate if you're a man, maybe bladder changes if you're a woman past menopause. These can absolutely be factors, but here's what almost nobody knows. Frequent nighttime urination, the medical term is nocturia, is one of the most reliable early warning signs of elevated blood pressure and early kidney stress. Here's the mechanism. When blood pressure is elevated, your kidneys are working under increased filtration pressure. During the day, when you're upright and active, gravity and normal physiology help manage that pressure. But when you lie down at night, that pressure redistributes. The kidneys, already working harder than normal, experience even more blood flow in the supine position. They respond by producing more urine. You wake up. A 2021 study published in the journal Hypertension followed 4,000 adults over 3 years. People who reported waking up once or more per night to urinate had a 40% higher probability of having undiagnosed hypertension compared to those who slept through the night. The relationship was dose-dependent. Waking once per night, 40% higher odds. Waking twice or more, nearly double. And here's the critical point. Nocturia caused by blood pressure precedes detectable kidney damage by years. It's a warning before the warning. Your kidneys are telling you every single night that something needs to change, and most people hit the bathroom and go back to sleep without a second thought. Sign number 3. At some point in the last few weeks, possibly longer, you noticed something in your vision. Maybe a brief moment where things seemed slightly blurred, maybe a flash of light at the edge of your visual field, maybe a sensation like looking through water for a few seconds before it passed. You probably didn't mention it to anyone. It went away. It seemed too small to matter. Here's what is actually happening. The retina, the light-sensitive layer at the back of your eye, is supplied by a network of tiny blood vessels.
These vessels are among the smallest and most pressure-sensitive in the entire human body. When systolic blood pressure rises above approximately 160 to 170, these microvessels begin to change. They narrow. They may develop microhemorrhages. In some cases, they develop flame-shaped bleeding visible on ophthalmological examination. The visual disturbances you experience, the blurring, the flashes, the brief dimming, are your retina signaling vascular damage. And the reason this matters beyond just your vision is this: the retinal blood vessels are the only blood vessels in the human body that can be examined directly and non-invasively. When an ophthalmologist looks at the back of your eye, they are looking at a window into the condition of every blood vessel in your body, including the ones supplying your heart and brain. Hypertensive retinopathy is present in approximately 15% of people with undiagnosed high blood pressure. If you have had visual disturbances, particularly flashes, blurring, or a sudden partial loss of vision that lasted even a few seconds, this is not a sign to monitor and wait. This is a sign to call your doctor today. Not because it definitely means hypertensive crisis, but because the same blood vessels being damaged in your eye are supplying your brain. And the same event that causes a transient visual disturbance can, in the wrong circumstances, cause a transient ischemic attack, what most people call a mini-stroke.
Sign number 4. You are tired in a way that sleep does not fix. Not the tiredness of a long week, not the tiredness of bad sleep, a persistent background fatigue that is just always there, a cognitive heaviness, a difficulty concentrating, a feeling that your thinking is slightly slower than it used to be. Most people attribute this to age, to stress, to the accumulated weight of a busy life. These are real factors, but there is a cardiovascular mechanism that almost nobody talks about. When blood pressure is chronically elevated, the heart works significantly harder with every beat. The left ventricle, the main pumping chamber, thickens over time to compensate for the increased load. This is called left ventricular hypertrophy. A thickened heart muscle is less efficient. It requires more oxygen to do the same work, and it delivers slightly less blood volume per beat than a healthy heart. The result? A subtle but measurable reduction in cardiac output, the total volume of oxygenated blood your body receives per minute. Your organs adapt, your muscles adapt, but your brain, which uses 20% of your body's total oxygen supply, despite being only 2% of your body weight, is the first organ to register the decline. The fatigue of hypertension is not dramatic. It does not knock you down. It is more like a dimmer switch slowly being turned down on your mental clarity, so gradually that you adapt to each new baseline and forget what fully energized used to feel like. And here is the clinical confirmation. In multiple studies examining patients newly diagnosed with hypertension and started on medication, cognitive test scores improved within 12 weeks of blood pressure normalization. Not because the medication made them smarter, because their brains were finally receiving the blood flow they had been starved of, sometimes for years. If you feel like your mental sharpness has declined, and especially if that decline has been gradual and progressive over the past few years, that is not a sign of normal aging. That is a sign worth investigating. Sign number 5. 2 things happen at night that most people with elevated blood pressure never connect to their cardiovascular health. First, heart palpitations while lying down. Not the dramatic racing heartbeat of an anxiety attack, a subtle awareness of your own heartbeat, the sensation of your heart beating in your chest when you were lying still trying to sleep, an occasional irregular beats, or a feeling that your heart skipped for a moment. When blood pressure is chronically elevated, the heart develops electrical irritability over time. The result is an increased frequency of ectopic beats, heartbeats that originate from an unusual location in the heart muscle rather than the normal electrical pathway. Most of these are benign in isolation, but their presence, particularly if they are new or increasing in frequency, is a signal that your heart's electrical system is under stress. In people with uncontrolled hypertension, sustained electrical irritability increases the risk of atrial fibrillation by approximately 3 to 4 times compared to people with normal blood pressure. The second nocturnal sign is snoring, combined with waking unrefreshed. This points to sleep apnea, the condition that is the single most commonly missed cause of treatment-resistant high blood pressure. 30 million Americans have sleep apnea and do not know it. Every time your airway collapses and your breathing stops for 10 to 40 seconds, your sympathetic nervous system fires an emergency response. Blood pressure spikes, sometimes to 200 millimeters of mercury, briefly in the middle of the night. This happens dozens, sometimes hundreds of times per night, and in the morning, your blood pressure is elevated, not because of what you ate or how stressed you were, but because your cardiovascular system spent the entire night responding to a breathing emergency. If your partner has mentioned your snoring, especially if they have described you stopping breathing and then gasping, or if you wake up regularly feeling like you didn't sleep at all, this is not just a comfort issue. This is a cardiovascular emergency playing out across every single night of your life. The Stop Bang questionnaire is a clinical tool that screens for sleep apnea in 2 minutes. I've linked it in the description. Take it today. Here is the honest answer.
If you recognized one of these signs, if any of the 5 resonated with something you have been experiencing, the action is simple. Go to a pharmacy, use the blood pressure monitor, sit for 5 minutes first, take 3 readings, average them, write the number down. If you're systolic, the top number, is consistently above 130, schedule an appointment with your doctor this week, not next month, this week. If it's above 160, call today. If it's above 180 and you have headaches or visual disturbances, go to an emergency room now. That's hypertensive urgency, a medical situation that requires same-day care. Most of you watching this video are not in emergency territory. Most of you are in the earlier zone, the zone where action now prevents the emergency later. And that action is simple, inexpensive, available at any pharmacy. The 5 minutes you spend taking that reading today might be the most important 5 minutes of your year. Now, if you do check your blood pressure and the number is higher than it should be, the next video I want you to watch is about 5 things your doctor can do in the next 30 days to get that number down, including one intervention that works faster than most blood pressure medications. That video is linked here. And if any of these 5 signs describe something you have been experiencing and you finally have a name for it, please share this with someone else who has been dismissing the same symptoms, because the most dangerous thing about high blood pressure is not that it's hard to treat, it's that it's hard to notice. Until now. This video is based on peer-reviewed medical research and is provided for educational purposes only. It is not a substitute for medical evaluation. If you are experiencing symptoms, please consult a medical professional. Study citations are in the description below.